Every year, pediatricians try and convince parents to have their child immunized with a flu vaccine. And every year we end up with about 50% of our patients being covered. But this year, more than ever, it's important that we cover these kids with flu vaccine because we are in the midst of a COVID epidemic or pandemic, and now the flu becomes the possibility of the perfect storm. Statistically, we immunize about 50% of our patients, and we should be doing better than that. The CDC has challenged us to get 75% coverage in our patients. And about 1 out of every 4 parents are somewhat hesitant to give the flu vaccine for various reasons. One is it has to be given every year. This is unlike the other immunizations that we offer the child that offer somewhat a lifetime protection. Secondly, the efficacy or the potency of the flu vaccine does vary year to year. But even if you get the flu after the flu vaccine in a low power year, it reduces the severity of the disease. Another reason that parents are hesitant to give the flu vaccine to their child is that a lot of people don't consider the flu to be a serious disease. Yet last year alone, there were 800,000 admissions to hospitals with no other diagnosis than influenza. And perhaps the most troubling reason for not getting the flu vaccine is that people think they're going to get the flu from the vaccine. This is wrong. This is false. There is no live virus in the flu. You will not get the flu from the vaccine. You may get a local reaction and some redness, a low-grade fever, and some soreness, but that's all. Now, we can't discuss the flu vaccine this year without discussing the elephant in the room, that is the COVID virus. The COVID virus has been predicted to increase this year. And so what we have to account for and adjust our treatments is the fact that COVID-19 is here and it's now. And regardless how we reopen the country, practice hand washing, masking, and social distancing, it's going to increase in prevalence this winter. The hope for a vaccine is really wishful thinking on this condition. There are currently 170 vaccines under investigation, only 10 of which have ever been given to human patients. None have gotten to the phase 4 or approval of the FDA because they have yet to prove the benefit outweighs the risk involved. So the vaccine in 1 year is really a reach. The quickest vaccine we ever developed was the mumps vaccine, which took 4 years. We've been trying to develop a vaccine for HIV. It's 36 years and counting, and we have none. So what is the role of the child in the flu shot in this COVID epidemic? Well, we know that what we're going to try and protect from COVID are the patients that are old or have chronic diseases. Luckily, children are not good carriers of the COVID virus, but they are excellent carriers of influenza. If that patient is subjected to both the COVID and the flu at the same time, it has what we call the double whammy or the perfect storm. And this is what we have to protect against. The more children we can immunize against flu, the more likely we are to protect those vulnerable patients. And that's why it is upon us to be more emphatic and more passionate about offering the flu vaccine. I always offer the flu vaccine, and I tell the parents the benefits of it. But I am more passionate this year in getting the flu vaccine into my patients to protect that vulnerable population. So what are we left with? Well, CDC wants 75% of our patients inoculated with the flu vaccine, and we'll try. Also, it is recommended that the naive patient or the patient that has never received a flu vaccine receive 2 vaccines before December 1st. And it follows that the fewer people that have influenza, the fewer people that will be exposed to the double whammy of flu and COVID virus.